The neural disorder that I chose for my final project is cerebral palsy. And this is a chronic progressive neurological disorder that impacts a person's ability to move and maintain balance and posture. And it's the most common motor disability in childhood. The reported prevalence of this disorder has varied throughout history, but the current incidence is about 3 to 4 in every 1,000 births. And it's more common in biological males and females and in Black children than white children. And it's typically diagnosed about age 12 to 24 months, but newer technologies have allowed for earlier diagnosis at about 6 months old. One commonly used tool for assessing the severity of the disorder is the gross motor function classification system, which classifies each patient with a level of disability from level 1, which is walking with few limitations, to level 5, which is severe limitations like a wheelchair being required for mobilization. Some common signs and symptoms include spasticity, which is stiffness in muscles, random or uncontrolled body movements, ataxia, balance problems, seizures, problems eating and swallowing, and so on. Most patients have congenital cerebral palsy, which means they're born with the disorder. And some of these risk factors can include maternal exposure to toxic chemicals, restricted intrauterine growth, TBI, inflammation, genetic mutations, and more. And the majority of patients with cerebral palsy have white matter damage, which can be seen on an MRI, as seen here on the right. Treatments are tailored to the individual needs of the patient and based on the goals of medical providers and family. Physical and occupational therapy are popular modalities and include stretching, massage, and induced movement therapy. Some patients may also undergo surgical procedures such as nerve blocks or soft tissue lengthening to mediate the pain and symptoms. Another commonly used thing is the use of botulinum toxin or BTA as an injection, and that can improve motor function in children with overactive muscles. Many patients who have comorbid psychiatric disorders will also address these with a mental health professional. And a new and promising treatment is the use of prenatal magnesium sulfate in premature births, and this is shown to reduce the risk of cerebral palsy and premature infant death from about 6.5% to 4.5%. To conclude, the life expectancy of people with cerebral palsy does vary with the severity of the disorder. So people with more mild cerebral palsy have a higher chance of survival beyond the age of 20 into adulthood than those with really severe cerebral palsy. And their quality of life may decline with age due to an increase in health problems like obesity and pain and cognitive deficits. It's important to note that the proper medical care is really expensive and therefore not accessible for everyone depending on their socioeconomic status. And more research is needed into this disorder and into the preventive and therapeutic modalities to improve the lives of those with cerebral palsy and their affected friends and families. Here are my resources. Thank you.